cluster of hantavirus infections occurred on a cruise ship sailing across the Atlantic Ocean. The number of infected people is increasing. Today, let's take a closer look at this issue. Before we get started, let's first find out what hantavirus is. Some people are worried, saying that COVID-19 is starting again, or that another pandemic might be coming, but that's a bit of an exaggeration. Experts agree that hantavirus is less transmissible than COVID-19, so it's unlikely we'll see as many infections as during the COVID-19 pandemic. Of course, hantavirus used to be a very serious disease with a fatality rate of up to 20%, so it's not something to take lightly, but I want to emphasize that there's no need to be overly anxious or worried. Now, let's take a look at what's happening right now. Tedros Adhanom Ghebreyesus, the Director General of the WHO, said at a press conference in Switzerland that there have been 8 reported cases so far, including 3 deaths. 5 of those cases have been confirmed as hantavirus, and 3 are suspected cases. As of May 7th, there were 3 confirmed cases, but 2 more were added the next day. Originally, hantavirus could only be transmitted through rodents, but this time, it was confirmed that human-to-human transmission occurred on the cruise ship. Later, it was found that the virus identified this time is the Andes virus, a variant of hantavirus. The Andes variant is known to be the only hantavirus variant capable of human-to-human transmission. The cruise ship MV Hondius was scheduled to sail from Ushuaia port in Argentina to Cape Verde, near Senegal on the west coast of Africa. However, a mass infection occurred during the trip, and it is said that the first fatalities, a Dutch couple, had been traveling in South America, including Argentina, before boarding the ship. However, the husband suddenly developed a fever, headache, and diarrhea, and then showed symptoms of shortness of breath before passing away on the cruise ship. After her husband passed away, the wife boarded a flight from St. Helena, a British territory, to Johannesburg on April 25. Her condition worsened on the plane, and she died in the emergency room in Johannesburg on April 26. A German passenger died suddenly on the cruise ship in Alta, but proper quarantine measures weren't implemented. The cruise operator, Oceanwide Expeditions, had 29 passengers disembark when they called at St. Helena, a British territory, on April 24. Among them was the person infected with hantavirus who I mentioned earlier. At that time, dozens of passengers had already returned to their home countries after finishing the trip. There were also passengers and crew members who had contact with the second deceased person on the flight, which greatly increased concerns about the spread. The countries of the disembarked passengers were also diverse, totaling 12: the United Kingdom, Canada, Denmark, Germany, the Netherlands, New Zealand, St. Kitts and Nevis, Singapore, Sweden, Switzerland, Turkey, and the United States. Tedros, the Director General of the WHO, said that although this is a serious matter, the WHO assesses the public health risk as low. He also said that this is the reason why the international health regulations exist and how they work. The WHO is working with multiple countries, information sources, and partners to respond. He emphasized that they are prioritizing patient care, ensuring the safety of the remaining passengers, and preventing further spread of the virus. Rahman Mohammed, acting director of WHO Emergency Alert, said that if public health measures are implemented and all countries work together, the outbreak will be limited. The problem is that this hantavirus is gradually spreading. The issue is that an additional suspected case has been found on the passenger plane where the second deceased person, whom I mentioned earlier, was on board. A crew member reportedly tested positive and was taken to the hospital. Above all, what the WHO is most concerned about right now is the incubation period. The incubation period for this hantavirus can be up to 6 weeks. Because of that, we can't rule out the possibility of additional cases. Currently, the Dutch authorities are taking preventive measures by contacting the passengers who were on that flight. The UK Health Security Agency said the person is self-isolating at home after returning. They are tracking contacts of these individuals and working with departments to trace passengers from the same flight as the confirmed case. The US Centers for Disease Control and Prevention is also monitoring returning citizens. Since a large number of passengers have dispersed to countries around the world, the entire world is currently making every effort to prevent additional confirmed cases. However, the WHO believes that the risk to the general public from this hantavirus outbreak is still considered low. The exact cause of this infection outbreak has not yet been clearly identified. Some health experts think the virus likely came from Argentina, where the ship departed. The WHO said no rats or other rodents carrying hantavirus were found on the ship, so the infection likely happened while passengers were in Argentina before boarding. Hantavirus is mainly transmitted through the excrement and saliva of rodents such as rats. For the Andes virus, a hantavirus variant in Argentina and Chile, rare human-to-human transmission has been reported. In particular, Argentina is known as a place with a high frequency of hantavirus infections worldwide. The cruise ship in question is still sailing. They planned to go to Cape Verde, but were denied entry there and in the Netherlands, so now they're wandering without a plan. On May 5th, the Spanish Ministry of Health stated that, following international law and humanitarian principles, the Canary Islands, with sufficient medical capacity, would accept the ship. Now the ship is heading there, but another issue has come up. A conflict has emerged between Spain's central government and the Canary Islands regional government. The Spanish government let the ship dock in the Canary Islands for humanitarian reasons, but did so without consulting the Canary Islands autonomous government. Fernando Clavijo, head of the Canary Islands autonomous government, strongly protested, saying the central government allowed the ship to dock without sharing enough information. He requested a meeting with Pedro Sanchez, Spain's prime minister, but since the decision is final, the cruise ship will arrive in the Canary Islands in 2 days. In fact, cruise ships are one of the places that infectious disease experts fear the most. That's because the very structure of cruise ships makes it extremely easy for viruses to spread. Hundreds or thousands of people live together for days or months inside one large steel structure, with closely packed rooms and many windowless cabins. Also, because the central air conditioning is connected throughout, there are ongoing concerns about air circulation. In shared spaces like restaurants, theaters, casinos, pools, and gyms, everyone uses them together. People also frequently share hallways and elevators. For the virus, it's an ideal environment to spread. This happened during COVID-19, as many remember with the Diamond Princess cruise ship docked at Yokohama Port in Japan. It all started when a passenger who boarded in Hong Kong tested positive, but a few days later, the number of infected people on the ship began to increase explosively. With over 700 confirmed cases among passengers and crew, media worldwide called the cruise ship a massive quarantine facility at sea. Especially at that time, even though the cabins were under quarantine, the infection kept spreading, which made the fear much greater. This Hantavirus outbreak is also causing similar fear. Because the ship is floating in the middle of the sea, it's difficult to quickly transfer patients or immediately deploy a large number of medical personnel. Moreover, once a ship starts being denied entry to ports, the situation becomes much more serious. In fact, the MV Hondius was also denied entry at several locations this time and had to wander at sea for a while. Passengers' fear of infection and anxiety about isolation can only increase simultaneously. One reason fear grew during this situation was that social media and some sensational outlets quickly spread unverified stories. Some even started saying that another COVID-like outbreak has begun, or that a new pandemic is coming. However, the consensus among experts so far is a bit different. The identified virus is not entirely new. It's the Andes strain of Hantavirus, which has long been reported in South America. WHO Secretary General Tedros Adhanom Ghebreyesus has also repeatedly emphasized that the current public health risk level is low. Vincent Ronan, an infectious disease expert, said the cruise ship's unique environment contributed to the mass infection. Some media outlets claim this Hantavirus will cause a pandemic just to boost their view counts. But what's interesting here is why the WHO keeps emphasizing over and over that the possibility of a pandemic is low. In fact, the WHO faced tremendous criticism after COVID-19. There was worldwide criticism that they warned about the risks of the coronavirus too late in the early stages. There was also ongoing controversy that the WHO was too passive regarding China's initial response. At the time, there were even claims that some countries suffered great damage because they trusted the WHO's announcements and kept their response levels low. Because of this, the WHO has no choice but to be extremely sensitive about this situation. If the WHO is once again judged to have misjudged the situation, its international credibility could take a huge hit. On the other hand, if they create excessive fear, it could shake the global financial markets, as well as the aviation and tourism industries. Especially since the world economy hasn't fully recovered after COVID-19, that's an added burden. That's why the WHO is being extremely cautious right now. They're acknowledging the risks, but are also wary of causing excessive fear. In fact, the WHO is even drawing a clear line by saying that this is a completely different virus from COVID-19 or the flu. However, at the same time, since the incubation period can be up to 6 weeks, they are not ruling out the possibility of additional infections. The most important thing is not to create unnecessary anxiety.